Hey guys, this is Dr. Hub. Whether you're in medicine, from specialty to super specialty, allied sciences, or simply curious, this focus content it delivers the key points you need to know. So we'll continue with the structures, passing through the skull foramina. So we are looking at the part 2. In case you haven't subscribed, please do subscribe and grow daily. Carotid canal. So what will be present in the carotid canal? Carotid canal, it will be the ICA, that is the internal carotid artery. Then comes the venous and sympathetic plexus. Venous and the sympathetic plexus, and this is around the artery. Around the artery. So carotid canal, the word carotid will be there, that is the internal carotid artery, and the venous and sympathetic plexus around the artery. Next, moving on to the jugular foramen. So what will be the jugular foramen? So under the jugular foramen comes the inferior petrosal sinus. Inferior petrosal sinus. This is the jugular. So inferior petrosal sinus. Then comes the middle meningeal branch of ascending pharyngeal artery. Ascending pharyngeal artery. Next will be the cranial nerve, the 9, 10 as well as 11. Then moving on, there will be the sigmoid sinus, that's continuing as the IJV, as well as the middle meningeal branch, and this is nothing but of the occipital artery. Then looking at the hypoglossal nerve, hypoglossal canal. So here in hypoglossal canal, it will be as the name suggests, it will be a hypoglossal nerve. So hypoglossal nerve is nothing but the cranial nerve 12. Then moving ahead with the foramen magnum. So foramen magnum, there is osteoligamentous. It is osteoligamentous. That is the anterior compartment. So this will include the apical ligament and tip of dens. Apical ligament or the tip of dens. Next, it also includes the upper band of cruciate ligament. Then comes the membrana tectoria. So to recap, the osteoligamentous is the anterior compartment of the foramen magnum. This includes the apical ligament and the tip of dens, then upper band of the cruciate ligament. So it has CD, that is cruciate, the tip of dens, as well as the membrane tectoria. Now moving on to the posterior aspect. The posterior aspect includes the neurovascular. So neurovascular, or it is also known as the posterior compartment. So this includes the lower end of the medulla oblongata. So lower end of the medulla oblongata, and this is along with the meninges. Then comes the fourth part of the vertebral artery. So lower end of medulla oblongata with the meninges, the fourth part of the vertebral artery. So this vertebral artery is surrounded by the sympathetic plexus of nerves. So it is surrounded by sympathetic plexus of nerves. Now moving ahead, the spinal roots of accessory is also present. the anterior and posterior spinal arteries, also the tonsils of the cerebellum. Thanks for watching. So in case you haven't subscribed, please do subscribe to learn and grow daily. And this is a special thank you note to all the subscribers of this channel. And we have a 30+ playlist subject wise, and it is in the description.